Well, welcome to today's update. It is Sunday, the 3rd of May. Now, I've got some interesting new data from UK hospitals at the moment that tells us interesting things about this virus in terms of the way it makes people sick. And I would expect this to apply to people all over the world because people are basically affected by this virus in very similar ways because we all are human beings. We all have the same basic biological structure, and the virus is very similar, almost the same in many parts of the world, indeed all over the world. The mutation rate in this virus does look like it's being quite low, quite slow rates of mutation, which is good. Then I've got to look at some things from the United States, from Europe, and from some other countries in the world. So let's start off with this data now from the UK hospitals. Now, before we do that, actually, we'll look at the total numbers. 3.5 million people officially diagnosed with the disease globally. 250,000 have died, unfortunately, and we know the real numbers are way higher than that. Now, this was interesting from Glasgow. Now, quite a few Scottish regions publish pretty well lifetime data, well, at the end of every day anyway. So in Glasgow, cumulatively, there's been 2,939 cases to date. And as of 4 o'clock, I think it was, yesterday, Saturday, there was 530 patients in hospital in the Greater Glasgow Hospital Group. 530 people. And 42 of those people, that's 7.8% of the 530, were in intensive care. So this is interesting. Of the people that were ill enough to be hospitalised, about 8% of them needed intensive care. So that's quite a reassuringly small number in many ways. And in Ayrshire, smaller area, it was 103 in hospital and 8 in intensive care. So again, similar percentage there really. And I just bring that in as an introduction because I want to look now in more detail at the Intensive Care National Audit Research Centre, what we call the ICNARC reports. Now, when we worked on intensive care, we used to have to file these reports every week. Actually, I didn't do it most. I passed it on to someone, and some poor person had to sit in front of a computer for hours typing in all this data. So this is collected from all the intensive care units in the UK, and it's good quality data. This is all the UK, actually, excluding Scotland. So this is England, Wales, Northern Ireland. And it's good quality data. Now, the reason I'm talking about these intensive care cases is because this kind of follows on from what we were looking at yesterday. Now, yesterday we had quite an alarming video, I thought, really, looking at the potential mortality, the number of people that could die in poorer parts of the world. And of course, the people that are in intensive care in the UK, the majority of those would have died without intensive care. And that means there is intensive care facilities for them to go to. But of course, in many parts of the world, we know this is not the case. There's nothing like enough intensive care beds. The quality and facilities there are nothing like good enough. And as well as that, because as we looked at yesterday, we think the numbers are going to rapidly increase in poorer areas, the health services are going to be overwhelmed anyway. And many people in poor areas of the world just don't have access to any decent hospital care at all anyway at the best of times. So a lot of these people that are in intensive care in the Western world, their equivalents, the equivalent percentages in many poor areas will simply die. And my great concern is that's going to greatly increase the case fatality rate in many lower income countries. But let's have a look at some of the data, which is telling us some fundamental things, I believe, about the disease. Now, this data was published on the 1st of May, so it was published on Friday. And the data, of course, there's always a delay in this, but the data was collected up to 4 p.m. on the 30th of April from 289 intensive care units in the UK. 9,000, they included all the patients that went into these intensive care units. So nearly 10,000 patients. So this is good quality data here. Now, just before I look at that in detail, I think I'll show you this interesting graph here. Now, this is from that ICNARC report, the latest ICNARC paper. Now, these are in critical care with outcome data received. So these are people we know what's happened to them. These are in critical care with only basic data received, and these are in critical care and we only know that they're there. But the point is, whatever data set, because there's always this lag here in data. But if we look at this is the ones with outcomes received. We see that the number is going down quite rapidly, and again here it's going down rapidly. And the people that are in intensive care, who we know are there but don't know anything about them, again, that's going down. So we see that the cases in intensive care are going down in the UK. Now, why are the cases going down in the UK? Because we have these lockdown measures in. We're getting more testing. It's nothing like where we need it to be. We need more testing and contact tracing. But the reason it's going down at the moment is because of the lockdown. People are simply not interacting. Therefore, people aren't catching it. Therefore, they're not incubating. Therefore, they're not getting clinical features. Therefore, they're not getting complications. Therefore, they're not getting severe complications. Therefore, less people are going into intensive care. There's always this lag effect, you see, because of the complications occurring quite a while after someone's initially been infected. So, but good to see they're going down. To get out of this lockdown measure, as we've discussed before, we need a lot more testing, tracking, treating, tracing, isolating people on a more specific basis. We're doing it rather crudely and rather expensively at the moment. It's a great deal we stopped all the individual contact tracing, but it is starting up again now, and more on that later on. Now, over 5,000 patients have outcomes reported, and over 2,403 patients are still in intensive care, so we don't know whether they're going to live or die yet. Although, as we see, we'll be able to make some pretty good inferences what's likely to happen. Now, of the 5,139 that we have outcome data for, so these are the patients that we now know what happened to them. As far as intensive care people are concerned, there's two outcomes. Either you leave intensive care or you die. That's it. So 2,497 patients have died. 2,642 have left ITU. Now, that doesn't mean that they have left hospital. That means they've gone back to the ward. Some will have left hospital, of course. So basically, without being too crude about it, means the case fatality rate in intensive care is around about 50%. Half of the patients that go to intensive care don't come out alive. And survival goes down further as time in intensive care increases. Now, this is always true. Intensive care is a very dangerous place to be. There's lots of complications go on as a result of intensive care interventions. And of course, the people that go there to begin with are the sickest patients. So it's always the case that the longer someone spends in intensive care, the more likely they are to die. And that is also the case specifically with COVID-19. Now, of the 7,537 that we initially looked at, that we know about, the mean age was 59.3, so that's down a little bit. So mean age was just under 60. And the interquartile range, so 50% of people were between the ages of 52 and 68. That means that 25% were younger than 52. 25% were older than 68. So fair amount of patients there. 25% of patients admitted to intensive care under the age of 52. Although the younger the patients are in intensive care, the more likely they are to survive. Now, sex. Male, 71.5%. Female, 30%. So basically it's a 70-30 split there, isn't it? So many more men developing complicated disease that requires intensive care than women. A ratio of 7-3 there, basically. Now, ethnicity. Again, we see that mixed, Asian and black are somewhat overrepresented in terms of their population profile. Now, again, a lot of this data comes from London and areas of the Midlands where there is a larger proportion of Asian, black and mixed race and other races. But it's still somewhat disproportionate in the amount that get the severe disease. And still no one seems to be talking about vitamin D, but you're sick of me talking about that already. Strange that no one seems to mention it though. 65% were ventilated in the first 24 hours, and 48% of those ventilated were still alive at 30 days. So again, we see that the proportion that needs ventilated, again, it's associated with a poorer prognosis. So 48%, that means 52% had died, in other words, within the 30-day monitoring period. Now, 33% were discharged alive within 30 days. So that means the discrepancy between the 48% and the 33% of the patients that are still in. So only 33% of patients in intensive care were discharged alive within 30 days. So quite a large proportion, while about 17-18% were still in intensive care. Now, what care did these patients need? Well, as you would expect, a large proportion needed advanced respiratory support. Now, what this means, advanced respiratory support normally means that the patient gets a tube down their throat, an endotracheal tube. We call this process intubation. You blow up a cuff in this tube and you bag them, you ventilate them through this, or sometimes they have a tracheostomy put directly into the trachea. So that's what we mean by advanced respiratory support. But a large number needed less advanced respiratory support, which is giving oxygen and sometimes giving CPAP, continuous positive pressure. CPAP, continuous positive airway pressure. Continuous positive airway pressure. The main thing this does is it keeps the alveoli open at the end of expiration so we don't get claps. And this patients do seem to do very well on CPAP, and of course all the intensive care people now are trying very hard not to put people on ventilation because they know it's associated with a fairly poor mortality. So less advanced respiratory support, quite a number as well. Now this does seem to have gone up. Patients requiring renal support, 23%. So 23% of patients in intensive care required renal replacement therapy, and that's out of this number of that's out of a sample size of 5,027. Now, this means that these patients develop what we call AKI. Now, AKI stands for acute kidney injury. Up until about 6-7 years ago, we used to call this acute renal failure. It just means the kidneys have stopped working. Now, why have the kidneys stopped working? Well, it's a common complication in very ill patients, that's one thing. But specifically, the COVID-19 virus has been found in kidneys of patients, so the virus does seem to infect the kidneys directly. And as well as that, another effect of the virus is that the blood becomes thicker, more sludgy, less liquid. And what you have in the kidneys, as you may know this, but in the kidneys you have these arterioles going in like this, and they divide up into huge networks of small capillaries. So we have what we call an afferent arteriole taking blood in to a huge network called a glomerulus of very small capillaries that's located in a capsule. I have got videos on kidneys if you want to watch this. And what happens is the blood goes through these absolutely tiny capillaries. So the blood's going in here and through these tiny capillaries. And the filtration's taking place there to form what's called the glomerular filtrate. But these capillaries in the glomeruli are so small, if the blood's thickened, the blood tends to get stuck in these capillaries, and that means that the blood doesn't circulate through, and of course that stops the whole thing from working. So we get this acute kidney injury requiring renal replacement therapy, which is basically a form of acute dialysis. So quite difficult to look after these patients. So 23% of them needing renal support therapy, complicated intensive care procedures, and of course that means that there's quite a run on renal replacement equipment, the dialysing machines, and the disposables that go with that. So that's quite concerning, and of course this requires sophisticated treatment, and if that wasn't available, these patients would almost certainly die. If your kidneys aren't working, the amount of potassium in the blood goes up, and that causes a cardiac arrest. Now, patients receiving advanced cardiac support, that was 27%. Now, this sounds quite dramatic, but advanced cardiac support is normally a matter of giving supportive drugs. So it's actually easier to do. You need less specialised equipment. It's more a matter of giving drugs to support the heart. Whereas for the renal replacement therapy, we need complicated machinery and infusions and all sorts of things. So I thought that was interesting data. And what it means is that in poorer areas of the world, all these patients that we're talking about now will probably simply die if they don't have access to this sophisticated care. And of course, we know many won't. Now, moving on to the United States, lots of cases, well over 1 million, 66,000 deaths. Now, I was just watching some US TV, and in Maine, Oregon, Kentucky, Washington, Los Angeles, Atlanta, Georgia, people out and about and demonstrating against the lockdown and not obeying social distancing. Now, if people congregate in these areas, as they have been doing, what this means is those that are asymptomatic and pre-symptomatic will spread the virus. That means there'll be more cases. That means a proportion of those cases will get ill, and a proportion of those cases will require intensive care, and a proportion of those cases will die. It's that simple. More people will die as social contacts increase. New York police out and about enforcing social distancing in parks, which is good. Gallup in New Mexico is completely sealed off, so there must be a bit of a cluster there in New Mexico, and the police have sealed that off, which is encouraging. No more data on that at the moment. Let's hope it's contained within Gallup and that the mortality rate in Gallup is low. But we know there will be some people developing complications and some people will die in Gallup. 34 states easing the lockdown in phases. Now, the vaccine is fast track. Operation Warp Speed, this has been called by the White House, to produce a vaccine which is going to be ready by January. This is interesting. Now, once the United States gets its act together, it can do amazing things. There's no question about that. So I'm not saying this is beyond the realms of possibility, but it's very hard to bypass the basic safety testing, the clinical trials and everything that's required to get a vaccine. So I hope a vaccine is ready for January. My slight concern is there that the warp drive is from science fiction. Let's hope that the vaccine by January is not science fiction. If it's achieved, there's no question it will be a stupendous achievement. And let's hope it is. Let's hope it is. Because when the United States gets its act together and develops momentum, it can really do quite amazing things. And let's hope this is one of them. So there are hopes for an early vaccine, but as of now, we simply don't know. 93 potential vaccines were looked at in the States, and 3 or 4 might succeed. So most of the vaccines that have been looked at won't get there, but 3 or 4 might. And I don't know if the United States are working on the same vaccine as the Oxford group in the UK, but as long as one of them gets there, all we need is one vaccine that works, as long as people are prepared to share it with the world, and that's all we need. One really good one is all we need. So it looks like we might end up with a few. So we might end up with 3 or 4 vaccines just from the United States, which would be great. But we can't bypass clinical trials. This is a difficult, slow process because we have to make sure it works and we have to make sure it's safe. 14 drugs in clinical trials, so 14 therapeutic trials going on in the United States looking for therapeutic drugs. One of those is remdesivir, which has been approved with an emergency order, so is being used at the moment. Quite complicated drug. There's no convincing evidence it lowers mortality rate, but it does seem to shorten the course of the illness. And how dangerous or toxic it is to use, I don't know. I've never used it or seen it used. But we will be getting more data on that. But it's certainly not a panacea. But anyway, the American authorities have passed it. Now, the other thing that came to mind that struck me today was the meat supply issue in the United States. And we did talk about the problems in meat packing plants in some detail a few videos ago, which were interesting because they gave us examples for everyone to follow, or rather mistakes for everyone to avoid, really, more to the point. But 19 states had outbreaks in meat packing plants, 5,000 cases and 20 deaths from meat plant workers. Now, let me make it quite clear. You can survive without meat for a few weeks. Don't worry about it. Just eat lentils or beans or cheese or eggs or other sources of protein. We don't need meat to survive. Vegetarians live for whole lifetimes, don't they? So, not advocating any particular strategy, but if you haven't got meat for a few days, don't worry about it. That won't adversely affect your health as long as you're eating a healthy mixed diet. Now, this was concerning. Now, I heard an American doctor talking about this inflammatory syndrome in children, which we did report on a few days ago from the UK. And it's also been identified in Italy and Spain, I think it was. Now, just to reassure everyone that children are way, way less likely to get severe disease than adults, but this does seem to be cropping up. Now, whether this seems to be a new inflammatory condition in children, whether it's associated with COVID or not, has not been definitively proved. But it's a heck of a coincidence if it's not associated with COVID that a new syndrome will just pop up at the same time as COVID has cropped up. So it looks like it's something to do with COVID-19, but it's not clear yet. But what we're looking out for is a fever in children. Now, that means we need to take children's temperatures. So everyone needs to have a thermometer really in the house. You can tell if children are hot, but it's good to have a thermometer. Rash on the torso, the front and back, and the tummy seems to be a thing. Irritated eyes and abdominal pain. And a proportion of these children do seem to get really quite ill. So I think the message is for now that if children develop fever with a rash, irritated eyes, probably with fever, abdominal pain, basically any parent that's worried and any of those features crop up, call your local healthcare providers and take localised advice on that. As far as I know, as of last week, there was only 20 cases in children in the UK. So this is uncommon, but this means that there could be a couple of hundred children across the United States could be potentially demonstrating these features. So do take very early healthcare advice if you're worried about children. Now, a bit of a quick Europe roundup. Ireland. Ireland's done reasonably well, but bear in mind, a small population island, of course. So 21,000 cases, 1,200 deaths, but that's from a relatively small population. Easing the lockdown on the 18th of May, returning to normal by August is the plan in 5 monitored stages. So let's hope that goes well for the people in Ireland. Ireland did lock down relatively early. One reason why the amount of deaths, deaths per capita in Ireland are probably comparable with anywhere else, actually, so it's not brilliant. But anyway, they are starting to ease the lockdown in these monitored stages. And Leo Varadkar, of course, is himself a doctor who's in charge of Ireland at the moment. Now, Germany, there's still more cases coming in Germany. I haven't got the precise numbers today. But Germany has reopened, or partly reopened. So we look with interest, and within the next week or two, we will know if the reopening measures that Germany has allowed will result in new and accelerated numbers of cases. Now, there will be more cases as a result of the opening up in Germany. It's a case of how many and if that is manageable. So there's certainly going to be more. I'd be amazed if there's not, but let's hope that's within manageable numbers. Churches are reopening but not allowing singing. It's been gauged that singing is going to spread the virus, which makes perfect sense if you're singing. The virus will be flying out of infected mouths at a great rate, I would have thought. strict restrictions in churches. And I think mosques and synagogues are currently working out safe ways to do it. So again, it's going to be monitoring this and seeing how many more cases are caused by the relaxation in Germany. But Germany, I mean, the churches are a good example because they are working out a new normal. So who would have imagined it? You know, the government saying you can go to church but you can't sing. That would have been unimaginable a few months ago. But people realise the importance of this now. And they're working out ways to have social distancing. I hope they've got very good ventilation. That's one of the simplest things. Open all the windows. Then any infected person who's breathing virus out, the viral load in the air will be greatly reduced simply by opening the windows. Hope they're doing that. Right, Austria. All shops now open. So again, it's a case of how many new cases in Austria occur as a result of this. So this whole European experiment, we're just monitoring it really. Spain, now the deaths in Spain are dropping off really quite dramatically, down to 164 deaths in the 24 hours up till today, up till Sunday. Still 164 deaths, it's still bad, but it's way, way, way less than it was. But it's added up to 25,100 deaths now in Spain. Now, the opening up in Spain that's starting to happen now, we wouldn't expect that to feed through in deaths, to increase in deaths for about another month. We'd expect first cases, then sick people, then hospitalisations, then intensive care admissions, then deaths. So it would take time. So I would expect the death rate in Spain to carry on dropping over the next couple of weeks. But then if the number of cases start increasing as a result of easing the lockdown, then the number of deaths could start rising again in about 3, 4, 5 weeks' time. And it's just such a simple idea in Spain. Different age groups are allowed out at different times. It just makes perfect sense. So I don't know what the schedule is, but different age groups get a couple of hours so that we're not getting young people infecting old people. So it seemed a really good idea that the Spanish are doing. Now, the UK, deaths, the second highest in Europe after Italy. So, and they're increasing. So it looks like the death rate in the UK could end up being the highest in Europe, at least for this first wave. 1.8 million people still shielded in the UK. Now, interestingly, when our Prime Minister was sick, he was in hospital, there was contingency plans for his death and for announcing that. Thankfully, it wasn't necessary. And we're told that it was a 50-50 probability that he was intubated when he was in intensive care. And of course, if he'd been intubated, we know that would have given him a 50% chance of survival or less. If he'd been intubated, he would have been more likely to die than survive. So thankfully, he didn't need to be intubated. His condition was just good enough to be managed on intensive care with non-invasive respiratory support. Don't know whether he was on CPAP or not. Probably, I don't know. But that's what he's talking about. And the only reason I mention an individual is because he has disclosed this in the public domain himself. So I'm not breaching any confidentialities there. This is public disclosure. And we're going to start taking temperatures before we go on public transport, which is good. So before public transport, people need the temperature checked, and they should every single person should wear a mask. No question about that whatsoever. Now, this is what happens if you don't prepare your notes properly. This New York bit should have been in with the United States. So a lot of deaths in New York City, and 98 deaths in one care home facility. 14% of the people in that care home died. Always been a problem. Deaths in care homes, which brings us on to the other problem we've been flagging up for a long time, problems in prisons. Venezuela. Now, on paper, not too many cases in Venezuela, but we know these are underreported. Now, what happens in a lot of poorer South American countries is the prisoners don't get fed by the authorities. The relatives have to bring in food for the prisoners. And of course, if visiting is banned to prevent spread of the virus, that means the prisoners don't eat. So prison riots and many deaths. I saw some Al Jazeera footage that was very distressing. A lot of people dead Don't know how many, but significant number dead in a prison riot in Venezuela. Already a country with massive healthcare challenges, as we know. Now, Brazil, not good news in Brazil either. More cases, more deaths. We mentioned yesterday about, was it Sao Paulo, where they're digging an extra 13,000 graves just in Sao Paulo. Again, prisons overcrowded, limited running water. Spread in prisons is, I'm afraid, guaranteed. It's going to happen. Yemen, very concerning because of the complete destruction of infrastructure after the war. 10 cases, that's going to go on increasing. Philippines, again, underreporting, but good to see that all passenger flights have been suspended in and out of the Philippines, as indeed is essentially the case in most places. If only we'd close down air travel earlier on, way earlier on. In fact, in the early stages, all we need to do was close down air travel out of China to buy ourselves a lot of time, but the World Health Organization specifically advised people to carry on flying in and out of China. Absolutely unbelievable the way we've been let down by the World Health Organization, in my view. Now, South Korea. 13 new cases, mostly imports. South Korea getting on top of things really well. Most places are open. Schools are going to reopen shortly. Any arrivals that do come from Europe and the United States are tested and quarantined for 14 days. So essentially no community spread at the moment in South Korea. So remarkably good news, very good success story in South Korea. Disciplined population, testing, but with precise tracking, contact tracing and isolation. So South Korea's used a very precision strategy to achieve the success it has. And they're also using masks. They also have good hand hygiene. And of course, they also have an app, which I'm going to talk about now. Now, I know at this stage, several of you have thrown your hands up in horror. But desperate times perhaps call for desperate measures. So the UK, for example, is live testing an app in the next few weeks. They're testing it now on the Isle of Wight. As over the next few days, and I think it's being tested now. So live testing app in the next few days that's going to be spread out into the whole country. Whole country is going to be asked to download the app. So everyone with a mobile phone in the UK, all 60 million of us or whatever, are going to be asked to download this app. Some won't. I will. It's going to Bluetooth ping with adjacent phones, and that's going to give us information about. So if you come into, so if someone becomes symptomatic and your Bluetooths have pinged 5 days before, it will alert you that you are at risk. And in this way, we can have much more targeted lockdowns. I hopefully everyone else can open up, and we can just have quarantine and isolation for the people that are infected and their contacts. And Bluetooth pings will tell us that. So I don't understand these things, but basically when my phone comes within range of someone else's phone, it's going to say, oh, John's just connected up with Joan's phone. And then if Joan becomes symptomatic, John will be informed that Joan has become symptomatic. I think that's the way it's going to work. Sounds like very similar to the system that's already been downloaded by well over 2 million Australians. So personally, I'm encouraged by that. Targeted isolation is the answer. Well, most people can go back to work. Hong Kong, electronic wristbands to make sure people don't breach quarantine. So people in quarantine in Hong Kong get a wristband geolocated, and if they go out, they're in trouble. It works. It's been working. You might not like it, but it has been working. China, you have a colour-based thing on your phone, so you can't go out in China unless you've got a green thing on your phone. There's a red, amber, and green. And the other thing is they have cameras on the street that are monitoring everyone that walks past to see if they've got a temperature. Now, of course, you can fiddle this by taking acetaminophen or paracetamol or ibuprofen that artificially lowers the temperature. So you can fiddle this one. But another interesting concept there, that you could have a thermal camera that monitors everyone that walks past, and if they have a fever, they can be stopped and asked to go home. Google and Apple are planning temporary location apps. So There you go. I know a lot of you don't like that, but it is working. These app-based tracking systems have worked in Taiwan, Hong Kong, China, South Korea, that I can think of offhand. So, and now we're all going to be asked to download one in the next couple of weeks in the UK. And as I say, I will be downloading it. Okay, that's it for today. Let's have a look at some of my lovely viewers now. Now, last time you were looking at me when you wanted to look at these two ladies who are much more pleasant to look at than I am. So I'm going to give them another go. So Arga and Magda from Poland. I had the screen on me. Let's see if I can get me in the corner. Second screen and me. There you go. So I had like a big picture of me on there where you wanted to see these, which is fantastic. And I apologise for the insult to the cat. That is a real cat. I said it doesn't. I'm not sure if that cat looks real or not, but if it is a real cat. So there you go. Thank you for watching from Poland, ladies. Okay, this is Barbara and Dean in Oregon. Cats seem to be popular. So thank you for watching Barbara and Dean in Oregon. In fact, let me take me off there. There we go. The United States. Debbie in Somerset in the UK. Now, this is interesting. Debbie's got her own mask there, which I'm sure you've made that yourself, Debbie, haven't you? I would certainly imagine you would have made that yourself. So this is good because it means when Debbie goes out, if she is infected, she's going to infect those around her less. So everyone should be wearing masks on public transport, and everyone should be wearing masks in public places such as supermarkets, as well as greatly improved hand hygiene. This is Dina and Vivian in Brooklyn. Now, I don't think I'm giving away any confidences here, Dina and Vivian, but this is mother and daughter. Amazing thing, genetics, isn't it? But they're actually in different parts of... I think they're both in Brooklyn, but they're in different parts of Brooklyn, so they can't actually meet up. So I'm sure they're doing so... well, they obviously are doing so because they've coordinated video watching. So thank you, Dina and Vivian in Brooklyn. Great picture, great picture. Now, this is Elsa in Iowa. And I don't know the name of the bird, but I'm not sure he's interested, but anyway. So that's Elsa watching in Iowa. This is Erin in New Brunswick, Canada. Looks like she works in a doctor's office. So good that you're watching in Canada, Erin, thank you. Oh, here's that parrot again. We've seen him already. Quite cute though. Obviously well trained. This is Jeff. I mask for you, you mask for me, together we win. Excellent point. Excellent point, Jeff. So what Jeff is saying is that we wear masks for the benefit of others, and if everyone wears a mask, I benefit as well. Excellent point, well made. Jeff in Mississippi. Mississippi. Now this is Lindsay watching with her snake Anastasia. So I'm not sure snakes are very interested, but thank you for watching, Lindsay. I do hope, well, you're obviously quite good friends with Anastasia, so that's okay. Generally, we wouldn't recommend putting snakes around your neck, of course. But thank you for watching, Lindsay. You're in AZ, so Arizona? I think that must be Arizona. So thank you for watching in Arizona. This is Logan in the Windy City, up in Chicago. So thanks for watching in Chicago, Logan. Oh, this is Martin in British Columbia. Just love workshops. Look at all that. You could just get in there and fiddle on with things, couldn't you? I'm sure Martin does him. I think Martin makes bird tables and nesting boxes. And that's in British Columbia, out on the west coast of Canada. This is Michelle in Texas. I've forgotten what Michelle's husband's called who took the photo, but nice patriotic mug. That's Michelle from the great state of Texas. Thank you for watching. This is Nico in Andrea in South Africa. Again, homemade masks, I'm sure. Worn here by Nico and Andrea in South Africa. So again, masks are good. We approve. Thank you for the picture. Stephanie also in Texas. It's a bit dark. Let's see if we can see Stephanie a bit better. Yeah, oh yeah, I think we can see her a bit there. Hi Stephanie. Watching in also in Texas. So you are most welcome and thank you for watching. It's quite a good picture actually with Stephanie being semi-silhouetted. Pity about me in the background, but there you go. Now this is Steve in Canada. Now I'm sure he sneaked on before, so he sent me another picture. Glad to see he's advocating vitamin D supplements because, as you know, I am taking vitamin D supplements. So do stay well, Steve in Canada, even if you have sneaked in twice. This is Tillman in Germany. It's very sophisticated, isn't it? Looks like Tillman's some sort of video editor or something. Anyway, it's got me on, so so thank you for watching, Tillman in Germany. Now this is Travel Richie. I'm not quite sure where Travel is from. Sorry, I've forgotten. But good to have you watching anyway. Thank you. And this is Victoria in Germany. Maybe going to Victoria a little bit. Yeah. Watching while she's doing the sewing. So thanks for watching in Germany, Victoria. That us? That's us. Okay, thank you for watching. Thank you for sending your pictures in, all those who did.